What's really happening? Are young people dying? Are mothers crying? Brothers in jail for a crime they never committed. What's going on? We are still carrying picket signs today for justice. The more things change, the more they stay the same. What's going on? I want to welcome you to Rhythm Flow Radio right here at IntellectualRadio.com, the house that Earl built. Hey, IntellectualRadio.com is an iHeart radio station streaming 24/7 on your smart device with internet access. We have a great show lined up for you today. Listen, we are going to educate you on clinical research. This is something that everybody needs to know about. So listen, I just want you to hold on for a minute. And when I come back, I'm going to have some guests on the screen. I know you wonder why I'm sitting up here with this thing that says happy birthday. I had to wear it when the show started. Okay, I had to wear it when the show first started because everybody, it was my birthday. I had a birthday. I'm a Cancer. What can I say? So when I came in, they fed me good. You know, I'm a big girl and I love to eat. So they fed me good and I had to wear this. But I'm going to take it off because I'm going to do my show. Okay? And I'm going to bring my guests in. But I'm going to play this music. And when we come back, the guests will be on the screen. And we're going to we're going to get right into the show. We're not going to waste any time talking about hot topics. So I'm going to play another song. We're going to come back. We're going to get the guests on the screen. We're going to get right into the meat of the show. So bear with me. Wanda, can you give me a little music back there? Do you have anything that you can give me? And I'm going to put this guest on the screen. I thank you so much. He's a manifestation of my dream. We must have been dreaming the same good thing. We just hooked up with the powers that be. They hooked up with the power in me. No more unrealistic arrangements. And I've had enough of going through changes. So here it is so good it makes me wonder. Why did it take so long to find my thunder? I got it right this time. This time I got it right. This time I got it right. I got it right. I learned to open the universe and ask just what is it worth to have and not to have the love of your life. And it said to me, you better get right. What a joy it used to be in harmony. Just letting love flow free and naturally. Okay, I want to welcome you back to Rhythm Flow Radio. Show right here in the house that Earl built, the #1 internet radio show, IntellectualRadio.com, an iHeart radio station, streaming 24/7 on your smart device with internet access. I'm going to have my guests introduce themselves because they know themselves better than I do. So I don't want to have to twist anybody's leg. So who wants to go first? Wait just a minute. Hold on. Wait just a minute. Okay. Okay, who said it going first?
I'm Ellen. I'm excited to go first, but I wanted to first of all, thank you so much for having us here today. This is very exciting. It's great to be here and to celebrate your birthday in style today. So, happy birthday. um, my name is Ellen Getz, and I'm here today to speak a little bit more about my nonprofit organization, CISCRIP, and the work that we do and the exciting event that we have coming up. But I'm a proud member of that team. I just feel very grateful for this opportunity. So thank you so much.
All right. Next.
Thank you. Good afternoon and happy birthday, belated or whatever the day. My name is Phyllis Rogers, founder and CEO of Pure Plus Education and Training Advocates. I'm so happy to be a part of your show today and in partnership for community engagement with Ellen Guest. Thank you. I'm really excited about the project that we're working on today.
And
Really
Phyllis,
excited.
I must say, you're Cancer too, right?
No, I'm a lion.
Oh, you're a lion. You're a Leo. Oh, I thought I had a. Oh, you're a Cancer.
This Saturday, 7/11.
All right. All right. A lion and two Cancers. How about that? Okay, Ellen. Why don't you tell us what is CISCRP?
So, besides being a fun acronym, long acronym to say, we are CISCRIP, so it stands for the Center for Information and Study on Clinical Research Participation. And I work as a director on the team for all of our live educational programs. CISCRIP was founded in 2003. We're an independent and globally focused nonprofit. And we provide outreach and education in a wide variety of formats to raise public and patient awareness, appreciation, and also knowledge about clinical research. And we're also advocates for study volunteers, for those who participate, as well as for their families and for healthcare providers. And we're always working on ways that we can really enhance study volunteer experiences as patients and partners in clinical research. We want to provide education and insights to assist research stakeholders as well to always be improving the study volunteer experience and their commitment to patient engagement. So we do a lot of different programs, and my team focuses on all of our live educational events.
Okay, may I ask you, clinical research and clinical trials, how are they different?
So clinical research is the broad umbrella term to describe any kind of clinical research study. So it could be an observational study, it might be, for example, like an exercise study that they want to see what it's like if you go on a walk every day, for example, for a certain amount of time. Or even I participated in a number of studies that I would consider within clinical research realm. There are surveys that I've participated in about relationships, long term, for example. But there are other kinds where clinical trials is similar to investigational drugs, so or investigational therapy. So when there is a particular drug that they're testing out to see how it might compare to something that's the standard form of care or treatment already on the market, or something fully novel and new that could really improve or enhance patient lives. So that's really, I would say, clinical trials fits within the umbrella term of clinical research.
Okay, what is the mission? You call it CISCRIPS. What is the mission? What is the mission?
So our mission is to educate the public and patients about clinical research, but we really want people to feel informed and empowered to make decisions about their health. Our goal is not to recruit for studies. We really advocate for patients, and we want to help connect them with resources and programs that might assist their needs. And then as part of that mission, we also offer a wide variety of educational resources, awareness campaigns, the live events like the AWARE program, and study volunteer appreciation events. And our team also does some custom kind of research projects, not related. We don't conduct studies, but we might try to learn a little bit more about patient journeys and their experience participating, for example, in a study. We also translate clinical trial results into summaries that we work to share directly with patients to show the impact that they made by being involved in a clinical trial and how they've helped to advance medical knowledge and science. So that's all part of our mission to empower the public to make informed decisions about their health and about clinical research.
And how long has this organization been around?
We've been around, I think, going on 18 years, which is really exciting. The organization was actually founded by my father, Ken Getz. And when I was younger, I would go to all of their events. I grew up in Boston, so I would go to events in Boston. And I always was really excited and felt very fulfilled by the work that CISPRA was doing. And I wanted to volunteer as soon as I was able. When I was in college, I helped out to help connect people with resources. And I've never looked back. I've been really appreciative and to be a part of this journey and work with such a great team.
Okay. Okay, Phyllis, tell us about Pure Plus, the organization that you are associated with.
Well, sure. Well, we were founded in 2002, so we have 1 year ahead of this group. It's 1 year, so we're in our 19th year. We started Pure Plus because of the community need to educate them at the level of their understanding. We were working at that time during the HIV/AIDS crisis, and we found out that a lot of times the community did not understand the language that was being presented to them. And so we would go back and sit with them to make sure that they understood. And with that, conversation started coming to us and say, you need to do this, you need to do this more. So we were encouraged by the community to continue to provide this service. And then we just came up with the name Peer Plus because we were working with peers. We want to educate and we taught people how to advocate for themselves to get the information that they need. So right now we are the bridge to support services and resources to people in the community in need. It doesn't matter who you are. And we're moving away from saying underserved and underrepresented. We just have to look at.
Okay. So tell me how you and Ellen got connected.
Ellen, why don't you go first?
Oh, thanks, Phyllis. Well, this is Phyllis very quickly became a lifelong friend for me. We were bringing a traveling educational exhibit to Chicago, and I got in touch with Dr. Prim Watson, and he suggested that I connect with the Patient Brigade out of the UIC. And I had learned about them. I was really impressed by the work that this team was putting together, and especially going out in the community and helping to connect with resources. And I received a phone call from Phyllis one day, and she had said, I hear you're coming to Chicago. I'm part of the Patient Brigade, but I want to tell you a little bit more about Pure Plus, and I want you to know we're here for you. We're here to welcome you with open arms to our community, and we believe in your mission and the work that you're doing, and we're really aligned. So let's find a way to work together. What can you do? And I can't say how much I appreciated that kind of support. And I got to travel to Chicago back in the fall. I got to meet Phyllis in person, and we worked on a couple of events together where her team was supporting us as clinical trial volunteers and navigators. So anytime any attendees at events we were going to had questions about either clinical research in general or clinical trials, maybe what that really means, what it entails to participate, her team was there to help her team also is well versed in many different languages, so they were able to also help us with meeting the community where they were, for their understanding and what they felt most comfortable with to learn about resources that would help them. And ever since, we've been looking for ways to work with Phyllis and Peer Plus, and we got really lucky where we've been working with them on the Aware for All program, and their team has been a really fantastic, supportive group. So that's our story. Do you have anything to add, Phyllis?
Yeah, as she says, the first program that we worked with Ellen was called the Share Project, and we were at Truman College, and it was a diverse group of people there. And the one piece that Pure Plus has, we have a young lady that's with us that's bilingual. That was really important, for that community that we were engaging on that day, on that cold, rainy day, but it was full. And we just found out from there, just in talking, that what she's doing and the people that we work with in the community, that it would be a good fit. And she is correct. I am one of the brigade members under the University of Illinois with Dr. Corinne Watson. It's a team of about 15 people from different diverse communities. But Pure Plus independently has been working directly with Ellen and Sistrip. And then we hosted, we worked with her with the Women's Expo out at Rosemont. Out at Rosemont, she wasn't there, but her representatives were there. And that was an event that probably brought a couple of thousand people. And we just saw then that it would be a good fit because, first of all, we know the community, we know the fit, and we know how to navigate, the participants. Pure Plus is a group of over 20 volunteers. So we were able to bring the volunteers and put them in strategic places and to navigate them to their research arena where Sistrip was hosting to get them the information. So it's worked out very well. And then she reached out to us to be a part of this Aware for All, and it just fits in with what we're doing.
Phyllis, may I ask you, you did say your organization worked with communities. May I ask you, what communities in particular do they work with?
Well, you know what? When I set up Pure Plus back in 2002, we set it up whereas we can work in any community with any health disparity in any particular any program. So we're not just locked into anything specific. Once a person reaches out to us, say like Sistrip, then we work with them to help them to fulfill what that need is for the community, to navigate them to where the people are based on the demographics that they're looking for. Had this been happening in person, we would have been at Project Hood at 6030 Drive, that's under the auspices of Pastor Corey Brooks and his team. But when those things changed, then we were going to have to do things in this way. So Pure Plus is able to work with any group at any time. Once we sit down and figure out the role that we can play, and they give us that ability, and then we just move forward with it. So we're just open with any group. So we're just not locked in, because our main piece has always been around cancer, but we work with the whole person. So what Ellen is bringing that piece around research, and for people to understand that that's something that we have to re-educate ourselves on and not get stuck with what happened, years and years ago. Things are different, and we're looking at a younger group of people that we're trying to encourage because of families with history.
So, Phyllis, are you saying that your organization can work with any group, any community here in Chicago?
Absolutely, we can. Yes, ma'am. I mean, we've worked from groups with, there's a group that's called All of Us, and All of Us does the DNA checking, to see what the family history is. We work with asthma. We work with people with dental. We can work with any health disparity that is directly affecting anyone in the community. And the one thing that we do have is we do have a person that is bilingual, and we're able to reach into the Latina community. So we're just not locked in one area. We are on the South Side, and we can go anywhere. Yes.
Okay.
But that makes us a little unique. If you look at our web page and you see the work that we are able to do, we can work in any, because what we'll do is we will research and we'll bring the people in that would match what the community is looking for. So when Ellen started to talk about this project, we knew that we would be interested in getting people that are seniors, people that may have had family members that have dealt with a diagnosis of cancer, or maybe diabetes or hypertension, or all of them. And now we're talking about people with COVID. So we didn't want to lock ourselves in. So we're just not a cancer service. We are diabetes, we are hypertension, we are dental, we are all of the above. And no age limit.
Okay. Oh,
Okay.
when you said no agent, okay, let's talk about Aware for All program. Okay, and the reason because
Sure.
I have a lot of questions about this program.
Okay.
So who wants to explain this program? I mean, you can,
I'm happy to get
okay.
yeah, I can get us started, and Phyllis, we'll tag team. We'll work
Sure,
together.
sure.
So Aware for All stands for awesome. So it's the Aware for All Clinical Research Education Program, and this is CISPRP's flagship. It's our grassroots outreach campaign, and we take this to cities around the world. And this is the first time we're actually moving it into a virtual model, which I'm really excited to tell you more about. I'm really trying to also share this information, make it as accessible as possible, and answer any questions that individuals may have about what it means to participate in clinical trials and how that impacts their lives. So we've decided to build it into a webinar format on July 16th from 4 to 6 p.m. But we've also set up a virtual health fair that will be launching at the end of this week on July 10th. And we'll be sharing a link, and people can visit. They can check out exhibit booths like Peer Plus is exhibiting inside, and it's like a virtual reality platform, and folks can gather information and resources at their own pace. But a little bit more about the event. So when we brought this to communities in the past, we always try to make sure we have a kind of health assessment or health screenings we can offer. Everything is free. We have offered free dinner or free breakfast, for example, if we posted it on a morning. And it's really a chance to put a face on the research and study volunteer and patient communities in every patient's own backyard. We want it to be kind of like a town hall, a safe space for people to ask questions and address concerns that they might have, and to also really get the information and resources they need. So to be able to work with Phyllis and her team at Pure Plus, and when Phyllis, you mentioned that you have a really diverse and really comprehensive kind of focus, that's exactly what we're looking for. We're not focused on a particular therapeutic area. We recognize that clinical research encompasses so many different focus areas, and especially healthy volunteers, for people interested in learning more. So for people to gather information through the fair and also through the symposium, we found that to be a really helpful model and helpful way to connect with the community. And one other item I'll mention, we want to also recognize and celebrate those who've participated and thank them for their contribution. So we recognize anyone who's participated in the study as a medical hero, and we always have a ceremony where we honor them and we show appreciation for their gift of participation in clinical research. So that's another special component of the event.
And for Pure Plus, we're extremely excited because this is something that's new and innovative and very, very creative. I just can't wait to see how it's all going to unfold. I know everyone is using Zoom for meetings and different symposiums and that, but to know that it is going to be a virtual health fair, that is just amazing. And if I'm correct, Ellen, I think we've signed up at least 40 vendors that will be involved, that they will be able to go into a link and to see what that vendor, what the services, that they provide. I know from the Chicago area, what the ones that I've been working with, we have at least 10 people that are coming directly through Peer Plus that will showcase the services, that they provide, from chiropractic services to breast cancer awareness, to just basic insurance. And just people will be able to go into the link and see the services that Peer Plus is able to provide for them. I know it's a good thing, and my team and I were just still kind of rattling our head about how is all of this going to work. And then today and yesterday we started adding in items, for the raffle. So it's not just going to be you the link and you go there. You are going to receive some information and education. She has a panel. I know Dr. Kareem Watson is going to speak. Everybody knows Dr. Watson from the University of Illinois, who is the direct link for myself and for Ellen to be introduced. And you couldn't have a better person. And I think you were introduced to him a few weeks ago, Miss Katie, because he was the moderator on our program when we talked about mental health
Right.
and wellness. Yeah, so Dr. Kareem Watson is he's on it. I mean, if there's a way to be connected with anyone and in the city, we go directly to Dr. Watson.
Okay, now this is
And he
a
is so
virtual.
inspiring.
Yes, yes.
Go ahead. I'm sorry.
This is a virtual community event. So people have to register online. Am I correct?
Yes.
So how would they register?
We ask them to register.
How would they
So
register?
they can go. All right, there are a couple different formats, and we would love for them to register so we can make it really easy for them to participate on the 16th. So they could go to awareforall.org, or they can also call us at 617-725-2750, and we can help them with registration. And basically, they'll receive a link that they can use the day of, or excuse me, they'll receive a link in advance. But for the day of the event, they don't have to download anything. It will live stream. They can just click on a link and they'll go right into the virtual, the webinar piece. As Phyllis was mentioning, Dr. Kareem Watson, we are so delighted that he'll be giving our overview presentation. He'll basically run through clinical research 101, basically all the different kinds of risks and benefits to consider, questions to ask if you're interested in participating. He'll talk a little bit about historical events and why diversity is so important in clinical trials. But he'll also be able to answer some questions in our live Q&A. And then we'll also have a panel discussion, as Phyllis was mentioning, with some industry stakeholders, some research professionals, and some study volunteers who can talk about their experience. And we're expecting it to be just a really a special event, a chance to really share in the pride for the Chicago community in the great work and the research that Chicago is doing right now. And then the virtual health fair, though, will be available starting on July 10th on the CISPRA website, but you can find it through the awareforall.org landing page. And once that's launched, it will be posted indefinitely, so you can return back to it anytime to check it out.
Okay, you said it'll be live streamed over on what social media site? Would it be on Facebook, YouTube, Instagram, Twitter? Where would it be? Where can they find it?
All right, so the link itself will go to On24. So it's a fairly new kind of webcast service that we've been familiarizing ourselves with, but we've been really impressed. It's a really cool interface. It's been really easy to use. So we'll be live streaming it through On24, but they can access it directly through awareforall.org to visit that link.
Okay. Now,
from what I'm understanding, it's extremely easy to navigate because we know with all the new social media and like what we're doing now is new, and some people feel intimidated. So we know that it is going to get easier and easier because more of these projects are, are springing up all over. So the easier it is to navigate, the better production that you would have and participation from the community. I mean, just like with yours, with StreamYard, that was really easy. We just hit a button. Didn't have to go through a lot of changes to get in there, So this is new, but really, really exciting. And if I'm correct, we should already have over 250 people that have registered. If I'm correct, that's
correct.
Yeah.
That's right. It's been really exciting to see the interest in the program, and we all are welcome to join us. And it will also be available on demand. So if you're not able to make the 16th, still register. You'll get the link, the materials, and you'll be able to watch it at your own convenience.
And what is the objective of this event?
So the objective is really to, let's see, we'll start with what people will get out of it from attending. So we want our attendees to learn a little bit more about what clinical research is all about. We want attendees to feel comfortable asking questions and to learn about different community resources that are available to them, as well as what Phyllis was saying before with local community organizations, if they'd like to get involved or learn more about their services and their programs. We want to help to connect attendees with those community groups. We want to also handhold, if anyone's interested in learning about clinical trials or clinical research in general, we can connect you with educational resources after the event as well. And I think as a whole, the CISPREP team really wants to try to take a look at all the really wonderful work that's being done already in Chicago, and we want to work together with as many different organizations as we can and make this and kind of consolidate a lot of different approaches to engage and to educate the community and to help make sure that these programs are as impactful as possible and as collaborative too as possible. So we want to leave behind a number of resources for the public, and besides the on-demand version of the webinar and the chance to walk around the virtual health fair at your convenience, we will also have a handbook to share with different resources and questions to ask. I think that's probably one of the biggest, most helpful pieces for me. I've participated and it helps me think through if this is the right choice for me. So we want people to feel even more informed about what it means to participate and feel like they're completely in control of this decision. It's theirs to make, and we want to feel that they know what they have the resources they need to advocate for their health.
This is clinical. Were you going to say something? Go ahead.
No, I was just saying absolutely, and it will be made available for them also, if I'm correct, to be a part of the chat if they're having questions.
Right.
That the presenters will be able to respond to them. So we want them to know that they are included.
Exactly.
It's not just that they're just going to see, they are included. We're encouraging them to be a part of the entire program.
That's right. And to that point, if they have questions even in advance of the event they want to ask us, they can include that as part of their registration or call the number, and we'll be able to take that down. We'll make sure those questions are addressed during the panel discussion.
Does this clinical research involve COVID-19?
We will have speakers talking a little bit more about COVID-19 related studies and research. Yep, we will be talking also in general about how studies are adapting right now in this current environment. Some are moving more to that kind of virtual or remote model where they're speaking on the phone or in even like a webcast like this directly with the patient. We'll talk a little bit more about that, and even if someone's involved in a study, what they might expect if things might be changing for them a little bit, if their study might be suspended or postponed, and things that they can do now to make sure that they can keep in touch and that the research team will keep in touch with them. So all general information about what it's like even participating in studies right now.
What other medical research will they be talking about? High blood pressure, diabetes, I mean, what are the things is included in the clinical research?
Sure. So as part of our panel, we'll have some researchers talking about oncology studies as well, and talking about rare disease studies. And we have a number of study volunteers. I believe one is a breast cancer survivor, and we have a mental health study, and a patient who recently participated in a mental health study. We'll be talking a little bit about his experience as well. So there will be a really well-rounded panel discussion. And of course, the exhibiting groups are very versatile and diverse in their backgrounds and their focus areas. And if there are any particular areas that individuals would like to learn even more about or be connected to other resources, they can get in touch with me. They can get in touch with our events team. We can put them in touch and share customized follow-up with them, whatever will help with their needs. But the overview presentation that Dr. Watson will provide will be a little bit more generally focused. And that we just really want to set the stage and talk a little bit about what clinical research entails, really the foundations around that.
Mhm.
But we're in addition to that, we'll have a couple of group health assessments. One will be a kind of stress management and mindful meditation health assessment. It's more of kind of something that the group can do all together, with some kind of breathing exercises. And then I believe we'll also have one that focuses a little bit more on memory and nutrition. So that will be a part of the webinar portion as well.
And that couldn't come at a better time, with everything that we're going through now with COVID, 19, and people are stressed out. People are still living in fear. We don't know, trying to figure out what to do and how to do it right. And so especially the piece around mental health, that's what we hosted a few weeks ago. And we hosted that for men's health. Men's health is something new to Care Plus. The men came to us and said, look, you never really do anything that focus, around men's health. So that's why we presented that. But I would encourage any organization that's working on any program at this time, please add in something around mental health and stress. Because people are making way. And I don't, sometimes there's so much in it that we don't realize how stressed we are until someone just spirals out. And so that's a really, really important piece. I'm excited about that will be a part of the camp.
Okay. What kind of feedback? What kind of feedback are you getting from people? The event is on the 16th. Are you getting feedback now? Are you getting positive feedback? You know.
They are. I think from the inquiries we've gotten so far, especially Katie, to your point before, I think a lot of folks are interested in learning about COVID-19 related studies and what's going on currently in Chicago. Overall, we've been getting a lot of interest in learning more about how the virtual fair is going to work, because it seems very different than what people are used to. But that's exciting for us. So, and we want to continue to instill that sense of community and pride in all the wonderful resources available here in Chicago. So that's some of the feedback we've gotten for this particular event. But in general, when we've hosted these programs before, I'd say that probably the favorite part of this program is hearing from the local study volunteers and the research professionals, getting to hear specifically about their experience, and often that's really uplifting, especially if one was involved in a clinical study that enhanced or maybe even saved their life. And the Med Hero ceremony is another special part of the program. But as Phyllis was saying before, hearing Dr. Watson even walking through the slides with us as we've been hearing his perspective, I think that's going to be a really exciting and inspiring part of the event as well. So I'm so excited about it on the 16th.
Okay.
And I'm just happy to know that we're one of the first groups here in the city of Chicago to partner with you guys to get this. So,
yeah. Good you. We're grateful for all of your outreach and support. And another item I'll mention, I know Phyllis and her team have been really helpful to make sure that this information is accessible also to those who may not have access to a computer or able to log on virtually. So we've been in discussions about phone calls. If folks are interested, we can kind of walk through the handbook and even share a physical copy of the handbook with them. We can also even walk through the virtual health fair with them. We can kind of talk through the different organizations. So we're trying to make this as accessible as we can. And our dream is to bring this program back to Chicago in a couple of years. Hopefully we can host that Project Hood and bring it over again in person.
Yes. And Katie, I would like for everyone to know that we reached out to the faith-based community last week. We reached out to probably about 20 churches. That I tried to look at the ones that were geographically, if we were going to be a Project Hood with some of those churches, with the zip codes where we're looking at, and I know we're going to be doing things around COVID. So I was looking at places where they said the numbers are high.
Yes.
And so we've gotten that information out to all of those faith-based communities. Now we know that services are not being held, but what I did was I reached out to churches that I have a direct relationship with. that I can get to someone directly. So hopefully that is going to bring that population in on that day, to be a part of the program. We're giving it the best try that we can.
Thank you, Phyllis. And to that point, I also just wanted to add, as part of the panel discussion, another key focus area will be on health advocacy and health equity. And this is something I know Dr. Watson will be talking a little bit about. We also have speakers who will be talking a little bit more about the importance of diversity in clinical research and really making sure that all feel included and that we can, I think as what Phyllis was saying, that this is about the full person and every individual, making sure that clinical research is equitable and accessible to all. And that's, I think, another core focus area of the program.
I just, I have to ask this question. And I have to ask this question because there is one historical event that sticks in my mind. And it was some clinical research. And that was the Tuskegee thing with the syphilis, which was part of a clinical research that went all wrong, that did not go right. How can African Americans, people of color, make sure that there is no mistrust? Because I believe that when it comes to clinical research and studies, that when it comes to people of color, that there is a lot of mistrust. And I believe that that's why a lot of times that they shy away from clinical research. And I know with COVID-19 and, a lot of the deaths, when it came to the African American community, a lot of deaths were African American. They were people of color. How can they be assured, that they're going to be treated right, that they can trust this? I mean, what mechanism is in place?
Can I start with it, Ellen? That's the one thing, and I'm glad you're asking it. That has been a lot of conversation, and it's going to be a lot of ongoing conversation because of the clinical trials that's going to be coming up and with the vaccines and for fear. So let's just say a group like Peer Plus.
Okay.
If we're working directly with Dr. Watson and the University of Illinois, the University of Chicago, the one thing that we have built in the community over the past 19 years is trust. But we're never going to dispel it for everybody. It's never going to happen. Let's just be real. It's never going to happen for everyone. But we know that if we don't start to join, that we will never know, and it still may be something that doesn't fit for us. So we will talk about it. It's going to have to be an open and honest conversation that we're going to have to say, and we're going to have to dispel some of what happened way back, when that happened. We know that. That's what everybody, when you hear research, that's the first thing that comes up. Whether people have the correct information or some pieces of it correct, or the pieces that they've already interjected. And regardless, some people will never do research. But for the mass amount that want to hear the information, I think that it would have to take a lot of trust from organizations, from faith-based organizations, from community organizations like Peer Plus, from organizations like the Patient Brigade that is out of the University of Illinois, and people like Dr. Kareem Watson and other providers that are in the community that people trust. And so when I say that, they say, okay, then if Dr. Watson is saying it or Pure Plus is saying it, then we're going to believe it because they know that we've done our homework, that we're not just going to jump in and wave a flag and just push people toward. They're going to trust our judgment. Mm-hmm. And then we would have to be a part of it ourselves for believability. So that's what we would do.
And
okay, I want to ask this question. What barriers has CISGRIP incorporated to reduce mistrust and thereby increase participation among African Americans?
So I would start by saying that question is or I would start by saying we really try to focus on education, and to Phyllis's point, connecting with local communities, and especially with individuals in the communities who are trusted thought leaders and health professionals, especially from African American communities and Latinx communities. We want to work closely with them to better understand the needs of the communities that we're looking to serve. And we're not trying to promote that everybody gets involved in studies. We feel that if we can provide education in an accessible format, and we can help to answer questions and to address concerns by also talking about how that we are aware and not hiding the fact that there have been tragic events in the past where people of color have been exploited or taken advantage of, and absolute tragedies where this is an open conversation and an open dialogue, and why these kinds of trials would not happen again, and to provide information about, specifically in the States, there are checks and balances in place where there are external ethical review committees who provide outside approval. There's more oversight now. So we try to talk a little bit more in general about the different phases of studies and what's entailed, and the kinds of referees in place that are looking out for patients and for patient safety. But we also want to work even more closely with diverse groups of research professionals that are helping to design these studies, and patients who are providing input to the designs of these studies and helping to monitor. So we work to collaborate with groups like Phyllis's, and also we work to make sure that other voices are heard as part of the trial designs, as part of the ways that these different research teams are engaging with the local community. Because we feel that the more the general public is involved, the more they'll feel a sense of connection to research, and we can help to dispel myths, but also really hear out concerns that people have. So it's kind of a big way of answering your question, Katie, but I think we focus on education and making that more accessible.
And no one is forced. It is once education is a choice. But we do encourage people to consider but to ask questions. That's the only way that we're going to be able to move forward with any of this. You have to have the conversation and to ask questions once, ask it twice, ask the questions until you feel comfortable in saying that, okay, I'm willing to take the next step. I'm going to digress this for a minute, but not really. A good family friend of ours who passed away earlier this year, he was a 4-time cancer survivor, but he did succumb at the first of the year. But he was the first person who joined the research at the University of Chicago for a lung transplant.
Wow.
For his lung transplant with little of no time. And I'm going to tell you, he outlived that probably a good 7 or 8 years. A good 7 or 8 years. And we had him at a program some years ago, and he was our presenter. And once he and his wife together, because she was a caregiver, started to share the story and why they joined, people walked up to him and said, you know what? I've never heard anything like this before. And so they walked away with a comfort. Why? Because they had someone in their face who had the scars, who had that transplant and had been in a research. So it has to be that, because sometimes it's a hard ticket to sell in not only in Black communities, but communities period, because it's a fear of something that we don't know, that we don't understand. We hear it. If it's not directly for us, then we pass by it. But once you can put a face to it, I think we will have a better chance and a more of an opportunity for people to want to join.
Okay.
And perhaps also a way to ensure that new treatments and new therapies can also reflect the populations who need them, and they can be helpful for those who need those new therapies. So that's another piece that why we focus on the diversity component, so that treatments can be not just accessible, but can help all different communities.
Absolutely. Okay.
And
All right.
like you say, this is nobody is twisting anybody's arm. It's strictly volunteer. They're going to get an education. All they got to do
Right.
is listen. Uh, I'm going to register. I well, now that I know that COVID is going to be discussed, that is something that I am interested in as an African American. I am very interested in it, and I myself, I am I'm going to register, and I want to tell everybody else this is a virtual clinic, and they should go online and they should register. I mean, this is a perfect opportunity, and you shouldn't pass it up. You know,
And in their own comfort of their home or wherever they are,
absolutely,
in the
absolutely.
comfort, there's no reason to feel intimidated by anything. And if they're computer savvy, to go into the chat, they're going to do the best to answer the questions. But just remind them that even after it's over, those questions can still be answered because sometimes people feel a fear of asking something, that they're not asking it correctly or whatever. We don't want anyone to feel intimidated. Put it out there. Let's start the conversation. Because the bottom line is it's here and we're going to have to be a part of it. It's what's the word, Miss Katie? They said if he brings you to it, he'll bring you through it.
That is
So
so
that's what we're going
correct.
to have to
That
do.
is so
Right.
correct.
We're going to have to stick to it to bring ourselves through it. So I'm excited.
And it's called Aware for All, Chicago, Illinois. It's a virtual community event Thursday, July 16th from 4 to 6 p.m. Central Daylight Time. You can register today at awareforall.org. That's AWAREFORALL.org. Or they have a phone number on here. You can call 877 633 4376, toll free. So use that information, or you can go to Rhythm Flow Radio or friends who like Rhythm Flow Radio and get this information. I'm going to post this on my personal Facebook page. That's Katie Lowe. I'm going to post it on Rhythm Flow Radio. It will also be posted on Friends Who Like Rhythm Flow Radio. You can find it on Intellectual Radio. You'll be able to find this in several different locations. So take part of this and get this education. Okay,
And it is posted on Pure Plus. It's on Pure Plus website also and our Facebook page. We have Facebook Pure Plus Education and Training Advocates, and our web is purepluscares.org. Purepluscares.org. It is definitely there.
Okay, Ellen, anything else you want to say? We got a few more minutes.
I just want to thank you so much for hosting us. This is where we hope that we'll be able to return back to Chicago in the future, but we look forward to seeing you at the virtual health event and hearing your perspective. And if you think it's helpful and if there's more that we can do in the community to help connect you with resources that are most important to you. So really looking forward to this, and thanks again for having us here tonight.
And like you say, the resources are not only for COVID-19, they're resources for all kind of health conditions. Okay.
That's correct. All kinds of health conditions, all kinds of clinical research studies. If anyone's interested in learning more, CISCRP actually has a free kind of concierge service. If anyone would like to connect to a study and doesn't feel confident navigating clinicaltrials.gov or websites where they could participate, we can help to connect them with research teams if they would like to ask questions. But our slogan is education before participation. And we want to make sure that before anybody even considers participating in a study, that they feel fully confident that they're in control, they're in the driver's seat every step of the way.
And you know what? I just want to say something. I think some of that is the fear because a lot of times people, it's how it's presented, and people don't feel like they have the opportunity to have that conversation. So we're opening up something that I know we do these a lot because we're different workshops. You go to workshops out of the country and host, but to have something that this is going to be intimate. This is an intimate conversation where people can sit back and say, you know what, maybe this is something that I really, really need to think about. And when you talk about the panel perspective, the one that's going to be there, when they take a look that people that are looking like them and sounding like them and have some concern for them, I think people will want to follow through. And Katie, thank you again for making this available. I know from based on what you had shared that people are really interested. They've been giving you all kinds of hits about, that they want to get more information about it. Hopefully we'll get a couple of thousand or so. I'm hoping from there, but I think we're on the right page. We're on the right page.
I'm honored to be a part of this. Um, I've always learned that you have to have an open mind.
Yeah.
Okay, they have a saying. What was that? A closed mouth don't get fed.
Correct.
You really have to have an open mind, and if you walk around with a closed mind and a closed mouth, you will lose out. And I have learned in life that you have to take chances. You really, really do. And I think that this event is an event that, like you say, is something you can do in the comfort of your own home. And I want to say to the listening audience, you might have someone that may be scared. And if you do, invite them to come along with you. Invite them to come along with you. You log on and you register and invite them to come along with you if they're scared. And let them watch you in action. And who knows, they may decide to do it too.
Absolutely.
Okay. Listen, I thank you. I thank you so much. If we got 5 minutes, we got 4 minutes left. And I want you to listen. I want you to have listen. I want you to have all of your time. So whatever you want to share in these last 3 minutes.
Ella, maybe what you can do is just give a shout out to some of your sponsors.
Absolutely.
Sure.
Let's give a shout out. Yeah.
So, yeah, absolutely. So we are working on this program with a really wonderful group of community organizations throughout Chicago. And actually, on the awareforoll.org page, you'll see a whole sampling of them. But I wanted to give a big shout out. We have a whole team of 10 organizations that are supporting us nationally to bring this program to 5 different communities throughout for the next 5 years. So our next step would be going to Chicago, and then we're going to Philadelphia with the same program. We'll keep moving around the country. So I would highly encourage you to take a look at the webpage, and if you're considering participating, there's some really wonderful also local organizations involved. I'm worried I might miss all of the wonderful groups we have. As Phyllis was saying, over 40 different exhibitors and that have all supported the program, also with some outreach support, helping to connect us with other community groups. So we highly encourage you to take a look at that. And if you'd like us to help connect to any of the organizations, please let us know. But the AIC is what they're called, and it's a group of 10 really dedicated organizations that are behind this mission and believing in this work of community engagement. So thank you so much to all of them for their support, and we hope we'll continue to be able to bring this program to other communities around the world.
Absolutely. And I would just like to say thank you to Ellen's team. I've been working closely with Joan and with Hope. We've been having Zoom conference calls, to pull all of this together. It's something new to all of us, but we're all excited. And we know nothing is perfect, but I think we're gonna be the first one that is not gonna be any errors or anything going on. It's gonna be wonderful. I'm so confident that it's gonna be wonderful. I just can't wait to see it. I just can't. I'm excited, and I know the people that too. They're excited also. So we just want to say thank you to everybody that is. You know what? Even if you're just hitting the link for one time, we want to say thank you because you don't have to. You don't have to. You know, it's giving of your time and your energy. So we just want to say thank you.
Yes.
Okay, I want to remind everybody the name of the event is Aware for All Chicago, Illinois. It is a virtual community event. Thursday, July 16th from 4 to 6 p.m. Central Daylight Time. Register today at awareforall.org. That's AWAREFORALL.org or call 877-633-4376. Toll free. All right, I want to remind everybody that you're listening to Rhythm Flow Radio right here on IntellectualRadio.com and iHeartRadio station, streaming 24/7 on your smart device with internet access. I want to thank you and have a great evening. All right, girl. No complaints and no regrets.